Bacterial vaginosis, or BV, is a common condition that affects women. It can cause discomfort and concern, but understanding it can help manage the symptoms effectively. BV happens when there's an imbalance in the vagina's natural bacteria. Normally, the vagina maintains a healthy balance of bacteria, but sometimes this balance can be disrupted. Our bodies are teeming with bacteria, and most of the time, they're harmless and even beneficial. These bacteria play a crucial role in maintaining our health by keeping harmful bacteria in check. The vagina, in particular, has a delicate balance of good and bad bacteria. This balance is essential for preventing infections and maintaining overall vaginal health. BV occurs when the bad bacteria outnumber the good. This overgrowth of harmful bacteria can lead to symptoms such as unusual discharge, odor, and discomfort. This imbalance disrupts the normal vaginal environment, making it more susceptible to infections and other issues. BV is not a sexually transmitted infection, but sexual activity can increase your risk. Factors such as having multiple sexual partners or new sexual partners can contribute to the development of BV. It's important to understand that BV and STIs are different and require different approaches to treatment. While both can cause similar symptoms, their causes and treatments are distinct. Knowing the difference can alleviate unnecessary worry and ensure you receive the right care. Proper diagnosis and treatment are key to managing BV effectively. If you're unsure, always consult a healthcare professional for guidance. They can provide the necessary information and treatment options to help you maintain your vaginal health. Bacterial vaginosis is incredibly common. In fact, it's the most common vaginal infection in women of reproductive age. While BV can affect women of all ages, it's particularly prevalent among those between 15 and 44 years old. Interestingly, race and ethnicity also seem to play a role. African American women are more likely to experience BV than women of other races. The reasons for this disparity aren't fully understood, but researchers are actively investigating potential factors. One of the tricky things about BV, or bacterial vaginosis, is that many women don't experience any symptoms at all. This can make it particularly challenging to identify and treat early. They may only become aware of an issue during a routine pelvic exam, which underscores the importance of regular checkups. However, when symptoms do occur, the most common one is an unusual vaginal discharge. This discharge can vary in consistency and color, but it is often described as thin and grayish-white. This discharge is often accompanied by a distinct fishy odor, which can be quite noticeable and distressing for many women. This odor tends to be more noticeable after sex, which can lead to discomfort and embarrassment. Some women also experience itching or burning around the vagina, but this is less common. These symptoms can cause significant discomfort and may interfere with daily activities. It's important to note that these symptoms can also be indicative of other conditions, such as yeast infections or sexually transmitted infections. Therefore, it's crucial to see a doctor for an accurate diagnosis and appropriate treatment. Regular medical consultations can help in early detection and management of BV, ensuring better health outcomes. The exact causes of bacterial vaginosis are still being unraveled, but we do know that certain factors can disrupt the vaginal ecosystem and increase the risk of developing BV. Douching, for instance, can wash away the good bacteria that normally keep the vagina healthy. Similarly, using scented soaps, bubble baths, or feminine hygiene products can also upset the delicate balance. Having a new sexual partner or multiple sexual partners can also increase your risk, as can smoking. It's thought that these activities may alter the vaginal pH, making it more hospitable to the bacteria that cause BV. Section 5. Diagnosis. Identifying bacterial vaginosis. Diagnosing bacterial vaginosis typically involves a visit to your healthcare provider. They will ask about your medical history and any symptoms you've been experiencing. A pelvic exam will likely be performed, during which a sample of your vaginal fluid will be collected. This sample will then be examined under a microscope to look for clues that point to BV. One of the key indicators is the presence of clue cells, which are vaginal cells coated in bacteria. Your doctor may also check the pH of your vaginal fluid, as a pH higher than 4.5 can suggest BV. Section 6. Treatment: restoring vaginal health. The good news is that bacterial vaginosis is easily treatable. The most common treatment is a course of antibiotics, usually prescribed as pills or a vaginal cream. It's essential to complete the full course of antibiotics as prescribed, even if your symptoms improve before you finish all the medication. This helps prevent the infection from recurring. While antibiotics are effective, they don't prevent BV from returning. Some women find that making certain lifestyle changes, such as avoiding douching and using condoms consistently, can help reduce their risk of recurrence. Section 7. Prevention: maintaining a healthy balance. In this section, we will discuss various strategies and tips to help you maintain a healthy vaginal environment and reduce the risk of bacterial vaginosis. While it's not always possible to prevent bacterial vaginosis entirely, there are several proactive steps you can take to maintain a healthy vaginal environment and significantly reduce your risk of developing this common infection. Regular consultations with your healthcare provider can help you stay informed and proactive about your vaginal health. As mentioned earlier, avoid douching, as it can disrupt the natural balance of bacteria in the vagina. Douching can remove beneficial bacteria, making it easier for harmful bacteria to grow and cause infections. Choose mild, unscented soaps and avoid feminine hygiene products that contain harsh chemicals or fragrances. These products can irritate the sensitive skin of the vaginal area and disrupt the natural pH balance, increasing the risk of infections. If you're sexually active, using condoms consistently can help lower your risk of BV and other infections. Condoms act as a barrier, preventing the exchange of bacteria and reducing the likelihood of infections. Additionally, wiping from front to back after using the toilet can help prevent bacteria from the rectum from entering the vagina. This simple practice can significantly reduce the risk of bacterial contamination and subsequent infections. Remember, maintaining a healthy balance is key to preventing bacterial vaginosis and ensuring overall vaginal health. Section 8. Complications: the importance of seeking care. While bacterial vaginosis is usually a mild infection, it can sometimes lead to complications if left untreated. For instance, BV can increase your susceptibility to sexually transmitted infections, including HIV. If you have BV while pregnant, it can increase the risk of preterm labor or low birth weight. Therefore, it's crucial to seek medical attention if you suspect you might have BV. Early diagnosis and treatment are key to preventing potential complications. Remember, taking care of your vaginal health is an important part of your overall well-being.